Ladies and gentlemen, welcome to my brand new channel, JD Speaks, and I'm your host, JD. Purposes of this channel is to get into all type of subjects, politics, current events, a little bit of this, a little bit of that. But how we gonna do it is we gonna break it down with logic and common sense. The only way that anything should be broken down. In order to do that, we're going to analyze, both sides or all sides of the situation. We're going to break it down and see what works best for us. So without further ado, let's get into this. Today's topic, we're going to be talking about Joe Biden's vaccine mandate. Now, for those of us that have already had COVID, survived, why is the vaccine necessary? That doesn't make sense to me. Fully vaccinated people who get a COVID-19 breakthrough infection can transmit the virus. Plainly put, even though you're fully vaccinated, you can still contract the virus and you can still transmit the virus. So this is an article from a Charlotte, North Carolina news source, and it's telling me that yes, COVID-19 has a 99% survival rate, but numbers don't tell the whole story. With that statement right there, you have told me enough of what I need to know. It is 99% survivable. I don't need anything else except my immune system and whatever I need to boost that in order to survive this pandemic. Now, to go along with this mandate, they also have an option for testing, getting this PCR test 1 or 2 times a week, something like that. Personally, I wouldn't be down with that test either. By the way they doing it, they taking a foot-long Q-tip and sticking it all the way down your nasal cavity to your brainstem, pretty much. That doesn't make sense to me. If you have the virus, you have the virus. It should be able to be detected from a simple mouth swab, some saliva. If you think about it, that makes total sense. In order to do a DNA test for a child, a simple mouth swab will do. I don't think they're using this test right also. And that can be confirmed by the inventor of the PCR test, Kerry Mullis. Take a listen.
I think misuse PCR is not quite. I don't think you can misuse PCR. No, the results, the interpretation of it. See, if you can say, if they could find this virus in you at all, and with PCR, if you do it well, you can find almost anything in anybody. It starts making you believe in the sort of Buddhist notion that everything is contained in everything else, right? I mean, because if you can amplify one single molecule up to something that you can really measure, which PCR can do, then there's just very few molecules that you don't have at least one single one of them in your body, okay? So that could be thought of as a misuse of it, just to claim that it's meaningful. And it is. Now, there's very little of what they call HIV, and what's been brought out here by Philpott and Isai already, the measurement for it is not exact at all. It's not as good as our measurement for things like apples. An apple is an apple. You know, you can get something that's kind of like, if you got enough things that look kind of like an apple and you stick them all together, you might think of it as an apple. But and HIV is like that. Those tests are all based on things that are invisible, and the results are inferred in a sense. PCR is separate from that. It's just a process that's used to make a whole lot of something out of something. That's what it is. But it's not. It doesn't tell you that you're sick, and it doesn't tell you that the thing you ended up with really was going to hurt you or anything.
Mr. Mullis also has some choice words for Dr. Anthony Fauci. We'll get on that in another video, but that can also be found on another YouTube channel, and I'll put the link down in the description box. Something else that just don't sit right with me about all of this, man, is how they trying to coerce us, bribe us. Why all the bribes? Why all the coercion? Here we got the Blasio. He out here trying to give away burgers and fries for y'all to come on down and get y'all shot, man. Here in West Virginia, the governor giving away lifted F-150s and rifles. But why the coercion tactics? If it's this good for us, people should be going down and lining up to get it. It's just not turning out like that. And to go along with that, simply put, a lot of this vaccine hesitancy is because we simply don't trust the government. Look at you guys' track record right here, the Tuskegee experiment. That speaks for itself. Another situation, 9/11, all that deaths, those guys were told, all the first responders, they were told, that the deaths wasn't going to harm them or nothing like that. And come to find out, it had detrimental health effects on these guys, a lot of these guys. Still hurting them today. I can get into another thing, Agent Orange. We can go back to Vietnam. Agent Orange. So, plain and simply put, a lot of people still don't have trust for the government. Just like Ronald Reagan said, the most terrifying words in the English language are, "I'm from the government and I'm here to help." So y'all think about that. Why is Joe Biden receiving his vaccine on what seems to be a fake Oval Office set? Are these more coercion tactics? I don't know. You be the judge. And after reviewing all this information from both sides, I've come to the conclusion that I myself will not be receiving this vaccine. And that's where I stand. I encourage you to do your own research. I'm begging you to do your own research. Don't be giving any of these bribes out here, going and lining up for no burgers and fries and no F-150s. Okay? Do your research. Come to your own conclusions and do what's best for you and your family. All right? All right. This JD signing out. Holla.